Hi, I'm Lisa.Saunders, and I want to tell you about the leading viral cause of birth defects, which is cytomegalovirus, or CMV. Unfortunately, I never knew about CMV when I was pregnant with my daughter in 1989. I was a child care worker, I was the mother of a toddler, and I volunteered in a church nursery, all things that put me at increased risk for CMV because CMV, cytomegalovirus, happens to be excreted in the saliva and urine of toddlers. I was always careful after changing a toddler's diaper to wash my hands with soap and water. But after wiping noses, picking up toys, I wasn't as diligent because I'm busy chasing after toddlers. Sometimes I'd use diaper wipes to wipe off my hands, but they do not kill the number one viral cause of birth defects, CMV. And here's a picture of my daughter, Elizabeth Saunders. She was born in 1989. When I was pregnant, I caught CMV. Again, none of my obstetricians told me about it. I had to learn about it after she was born, and then I was given information in the hospital saying that women who care for young children are at increased risk for CMV. I've been working ever since then. That's 1989. She died in 2006 during a seizure. Epilepsy was one of her many health complications because she was born with a severely small, damaged brain. She suffered with epilepsy for quite a few years, and then it finally took her life. And I've been working even harder since then. She died in 2006 to raise awareness, and it's very difficult because people haven't heard about it from their doctors. There's no national CMV awareness campaigns. And the big inconvenient truth about CMV is that it's prevalent, quite prevalent really, in daycare centers. In fact, here's a recent quote from Dr. Jason Brophy, a pediatric infectious disease specialist. He was quoted in the Ottawa Citizen saying, quote, "Almost all the babies that I see who have congenital CMV, there is an older toddler at home who is in daycare. That is a very common presentation. The mom gets her primary infection through an older child who is in daycare, and that is when it goes to the baby." And the American Academy of Pediatrics states in their 2015 publication, Red Book, that on average, 30 to 40% of preschoolers in daycare excrete CMV in their saliva and or urine. Although I helped Connecticut pass a law in 2015, which requires that newborn who fail their newborn hearing screen be tested for CMV, CMV prevention remains very little known in the state of Connecticut and many states throughout the United States. Even though child care providers and people who work in early childhood education have an occupational risk for it, they don't know about it either, according to recent surveys, or at least the majority don't. And so many people respond to me, if CMV was a problem, my doctor would tell me about it. Not necessarily. This is why I believe I came up with 6 reasons why you probably haven't heard of CMV, or most women haven't heard of CMV. Number 1, doctors don't want to frighten, worry, or burden patients. Here is a quote from a New York Times article in 2016. Quote, "The American College of Obstetricians and Gynecologists, or ACOG, used to encourage counseling for pregnant women on how to avoid CMV. But last year, the college reversed course, saying patient instruction remains unproven as a method to reduce the risk of congenital CMV infection. Some experts argue that because there is no vaccine or proven treatment, there is no point in worrying expectant women about the virus. Guidelines from ACOG suggest that pregnant women will find CMV prevention, quote, impractical and burdensome, end quote, especially if they are told not to kiss their toddlers on the mouth, a possible route of transmission." The second reason why I think most women haven't heard of congenital CMV is that there is no national CMV public awareness campaign in the United States. Here is a quote from Clinical Advisor. Quote, "Despite being the leading cause of mental retardation and disability in children, there are currently no national public awareness campaigns to educate expectant mothers about congenital CMV." That was in 2014. Also, there was low media coverage about CMV as compared to Zika. In the Health News Review article titled, "Why Does CMV Get So Much Less News Coverage Than Zika, Despite Causing Far More Birth Defects?" the author states, quote, researchers we spoke with identified the same factors, fear and the epidemic/endemic nature of the diseases, as driving the media disparity. And number 4, CMV has a low profile. According to the article, "Washing Our Hands of the Congenital Cytomegalovirus Disease Epidemic," published in BMC Public Health, quote, "The virtual absence of a prevention message has been due, in part, to the low profile of congenital CMV. Infection is usually asymptomatic in both mother and infant, and when symptoms do occur, they are nonspecific. So most CMV infections go undiagnosed." Number 5, unlike Germany, there is no U.S. law regulating methods of CMV control in the childcare setting. According to the Department of Labor, quote, "Education and training requirements vary by setting, state, and employer," end quote. In most states, except Utah and Idaho, childcare centers are not instructed to tell workers about CMV. U.S. workers have the right to receive, quote, "information and training about hazards," end quote, according to the Occupational Safety and Health Act of 1970. Number 6, CMV prevention education is not part of a doctor's standard of care. Here are some things that I need to happen to raise awareness of CMV. Child care licensing agencies need to instruct child care centers and preschools to tell their staff about CMV. The book, Model Child Care Health Policies, put out by the Pennsylvania chapter of the American Academy of Pediatrics, has a sample document to be signed by staff, paid or volunteer, to show, quote, "acceptance of occupational risk by staff members," end quote, which includes exposure to infectious diseases, including infections that can damage a fetus during pregnancy. Another thing that can happen is that I think child care policymakers should be made aware of the landmark decision in New South Wales, Australia. If you go to the Queensland Government Australia webpage titled "Cytomegalovirus in Early Childhood Education and Care Services," you will read, quote, "A child care worker and her severely disabled son were awarded $4.65 million. A court of appeal ruled the child's disabilities resulted from the woman being infected with cytomegalovirus at work. Hughes versus SDN Children's Services, 2002. Because so many parents have children in group care, if child care providers are educated about CMV, that message should get to the parents who they serve. So that's one way to reach them. The ways that you can help are contact your countries, state, counties, child care licensing programs, public health departments, labor departments, and labor unions. Ask what they are doing to protect the unborn children of their workers. You can send them to respected CMV prevention materials that you can find at the Centers for Disease Control and Prevention. Just go to cdc.gov/CMV. You can look online at the American Academy of Pediatrics co-authored book called "Caring for Our Children." It has the policy outline called "Staff Education and Policies on Cytomegalovirus." And you can go right on the website, just Google that and you'll find it. Or you just go to rckids.org/cfoc/database/7.7.1.1. Go to the National CMV Foundation webpage. They have downloads and flyers, things that you can use to show people how to prevent CMV. And you can also find additional resources on my CMV blog at congenitalcmv.blogspot.com, or contact me, Lisa Saunders, at P.O. Box 389, Mystic, Connecticut 06355, or email me at lisa.saunders@nationalcmv.org. Thank you.